Send in the next patient, please. Hello there. Could I take your name and age, please? Excellent. Oh, you have the most beautiful. Oh, I'm sorry. Right. If I have your consent, today we will be carrying out a test on your cranial nerves. Is that okay? Excellent. Okay. Well, a couple of quick questions. Have you been feeling well recently in yourself? Excellent. I mean, you look well enough. Now I'm looking at you. Very sorry. And yes, have you had any change in your taste or smell or anything of that nature? Right. Excellent. Well, everything seems in order so far. Yes, we're just going to be carrying out a few visual tests, if that's okay. We're just going to be carrying out a few visual tests, if that's okay. Excellent. Right. Well, let's get right into it. And yes, I'll stop checking you out. No problem at all. Here we go. Okay, so for how this next part is going to work, I'm just going to cover each eye one at a time. And I've got a piece of paper with some letters on. The letters are going to decrease in size, if that's okay. And I just want you to read the letters out. And obviously just stop when you can't read them anymore, because they do get pretty small. Is that okay? Excellent. Well, here we go. So I'm just going to cover this eye here and just read what you can on the sheet. You have really beautiful eyes. It's very unprofessional of me. I'm sorry. I'm very sorry. You keep going. That's excellent. That's excellent. Okay. Let's try this again, but with the other eye closed this time. Okay. Wow. I think I could look at you all day, honestly. Yes, sorry. Excellent. You've done a really good job of that. Well done for that part. Okay, so the next part of this test is going to involve me shining a light in your eyes, just so you're aware of that so it doesn't startle you, okay? That's excellent. Basically, I just want you to focus on my nose and don't look away from the nose and don't look at the light, okay? And again, we're going to be testing one eye at a time, and I'm just going to be shining the light on and off your eye to see how your pupils dilate. Does that make sense? Excellent. You're such a good patient. Here we go. Again, just going to cover one eye. You keep focusing right on my nose. Don't look anywhere else. Okay, here we go. Brilliant. So are you single then, or are you taken? Or... Okay, you had someone, but now you're single. Sounds like opportune timing to me. Okay, very good. I'm just going to change eyes now. Again, keep focus on my nose. I'm not usually this flirty, but you're just having this effect on me that I just can't help myself. I'm very sorry. It's very unprofessional of me, but let's get through this exam first. And that's brilliant. Okay, so for the next part, again, I want you to keep focused on my nose here. And I'm just going to swing the light from one eye to the next. From one eye to the next. Is that okay? Okay, again, just focus on my nose and don't look at the light. Okay, excellent. So from this eye over to this eye. And back again. And back again. Beautiful. This light is just bringing out all your perfections. Beautiful. Keep focused on my nose. You're doing excellent. Absolutely excellent. Did I tell you you look gorgeous today? I did. Oh, I'm very sorry. And back again. Excellent. You've passed that part of the test with flying colours. And you might actually get my mobile number soon, so that's a bonus, right? Okay, so actually just one last part of this test. Again, I want you to focus right dead center of my nose again. And once I tell you to, then I want you to focus on the pen, okay? But not until I tell you to, okay? I know it's hard to leave my focus because you want to look at me all the time. You know, we've just got this natural chemistry, and that's okay. But when I say I do need you to look at the pen, I'm very sorry. Okay, excellent. Okay, so focus on me as hard as you can, looking right into my eyes if you need to do that. Okay, here it comes. Now the pen. Excellent. Try that again. Keep focused on my nose, and the pen's going to come in. But don't look at it until I tell you to, okay? Keep looking at me. Now look at the pen. Excellent. One last time. Focus right here. So good. You're so obedient. And here we go. Keep focused on me, focused on me, focused on me. Now look at the pen. Brilliant. Excellent. That's that part concluded. Okay, so for this next part, I want you to basically focus on my fingers, and I want you to, once I wiggle one of them, I want you to focus on that one. Until then, I want you to focus again, right here, on my nose, in my eyes, whichever you prefer, and keep focused until then. But as soon as I wiggle one, I want you to look at that one, okay? Excellent. Okay, here we go, here we go. Excellent. Yeah. Brilliant. You're so good at this. Okay, I'm going to reposition a little bit more. Here we go. There we are. And again, focus on me, not the fingers, and only the fingers when I wiggle them, okay? Okay, you're so good at this. You thought I was going to go back, didn't you? And again. Brilliant. Okay. The next part, I'm just going to kind of test your field of vision. So basically, what I'm going to do is I'm going to cover again one of your eyes, and I want you to tell me when my other hand comes into focus. Does that make sense? Excellent. So yeah, actually, you said you're single, and you're looking for a rebound. Is that what you said? No, you didn't say that. Oh, well, maybe you are. Oh, excellent. And yeah, are you free later? Maybe we can catch. Sorry, I have another patient, and I really shouldn't keep getting distracted. It's my fault. It's completely my fault. Anyway, I'm gonna cover this eye here, and I want you to tell me when the finger comes into vision, okay? All right, and again. Brilliant. And once more. Excellent. One more time. Brilliant. I want to switch eyes. Same thing again, just let me know when it comes into vision. And brilliant. And again. Excellent. Have you done one of these before? You're a natural talent. Clearly nothing wrong going on here. You're just the perfect client. Thank you so much. Very perfect, actually. Okay, so again, very simple instructions for this next part. I want you to, again, focus on my finger when I show you it, and I want you to follow it around as best as you can with your eyes. One thing before we start this section is I need to know if you've had any double vision recently. I don't think when you're being drunk counts. I think we all get that, but apart from that, you're fine, right? Okay, excellent. And yes, just let me know during this section if you do get any double vision, because we will have to note that down. But apart from that, I think we're good to go, okay? Excellent again. So just follow this finger as best as you can. There it is. Right on the tip. Brilliant. Excellent. Change fingers. There we go. Any double vision? No. Looks like you're doing this well. Perfect. Well, in terms of what I just tested, it looks okay, but I think both of us might be having a little bit of double vision later, if you know what I'm trying to say. Okay, so the next part, we're going to test the sensitivity of your skin. And I do have this little cotton wool bud here to facilitate that. So I'm just going to touch you with it here. You feel that? Excellent. Okay, so now what I want you to do is focus on my voice and listen to my instructions, but I want you to close those eyes for me. Just keep them closed. That's it. Excellent. Excellent. Right. Close your eyes and focus on feeling this cotton wool bud in a second. Okay, and I want you to tell me when you feel it. All right. Okay, here we go. There we go. Excellent. Very good. Wunderbar. Perfect. You passed that one with flying colours. Well done. Okay, so again, we're going to be again touching your face. And again, we're just going to see how your muscles in your face react to these certain things, okay? So, again, just focus, just relax yourself, it's fine. And just listen to the instructions, okay? Okay, so we're just going to touch here and here. Could you tense your jaw for me? Excellent. And again, here and here. Relax the jaw. Beautiful. You got such a beautiful jawline as well. Okay, perfect. And this time, I want you to open your mouth. Keep your mouth open for me. There we go. Excellent. Let me see that beautiful smile. Keep it open, and I'm going to push down on your head and push up on your jaw. And I want you to resist against that. Okay. And again. Excellent. Once more. Perfect. Really good. I think everything here is looking good, including you. So, like, do you prefer, like, what type of cuisine? Are you like a Chinese person? Do you like more Italian food? What do you fancy? I mean, I fancy you. Yes, I think that's clear at this point. But like, what do you want? And we'll go for that. Sorry, we should finish this off, shouldn't we? Okay, so again, this next section is going to be some more face touching, okay? And basically, yeah, I just want to see how you respond. So can you raise your eyebrows for me? And I'll even do it for you as well. It's like this. Okay, good. Now I want you to squint and squeeze them in really tight. And I'm going to try and open them, but I want you to resist that for me, okay? So yeah, close them and hold them down really tight. Perfect. Now I want you to puff out your cheeks like this. And again, I'm going to try and close them in, okay? Good resistance, good resistance. And now to finish off, I just want you to give us a big smile. There we go. Perfect, perfect. Really good, really clean. Okay, the next part of the test is going to be a bit more auditory. A couple of questions first. Again, you haven't noticed any change in your taste and smell recently, right? Okay, that's what I thought. And have you been hearing things any louder than normal? Right, okay. So basically how this is going to work is I'm going to place one hand over one ear and I'm going to whisper in the other. I want you to just repeat back what you hear from me whispering, okay? It's pretty simple. Okay, so we're going to go here, cover this ear, and then we're going to whisper in the other. Cetera. How was that? What was that word? You want one more time? Okay, here we go. Cetera. Brilliant. And this other ear now, same again. Spaghetti. Once more. Spaghetti. How was that? Good? Okay, there we go. Okay, so we're going to do that actually one more time, but I'm going to be a little bit further away from the ears this time just to see how that changes things for you, okay? Excellent. So here we go. Right ear, and I'm going to whisper in this other one, okay? Perfect. Here we go. Meatballs. Meatballs. And the other one. 69. 69. You got it. Perfect, perfect. Everything seems fine on that front. A couple more things. This time I'm going to hold your head in place and I want you to, when I say turn it this way, I just want you to resist, and then same with the other way, okay? Excellent. Okay, so I've got your head there. You want to turn it for me. Very good. Good resistance. And same again and again. Perfect, perfect. The last thing I need you to do, actually, is I need you to stick your tongue out, and I want to see how things are with the tongue and the mouth. Okay. I know it sounds like I'm joking, but I'm actually not. I'm being serious. But I'd like to maybe see your tongue actually a bit more close up later. We can talk about that soon. Yeah. So you just stick it out for me. That's it there. I want you to put it back in your mouth, and I want you to press it against your cheek as I'm pressing in. And again, it's just a resistance test. So you press it there. There we go. Perfect. Same on this side with this cheek. One more time on this side. Really good, really good. And I think with that concludes today's cranial nerve exam with me, Dr. Sammy. And honestly, I think you've passed with flying colours. And I've had a really great time. I hope you have. I got lucky today. And what's your number again? Okay. Yeah, I've got that. I'll give you a text later, and maybe we can get a bite to eat, or maybe come back to my place afterwards. That sound good? Okay. Well, I'll see you then. Okay. All right. Goodbye now.